Welcome everyone to the NEMSIS V3 implementation call. Today is August 25th. We appreciate you being with us this morning. We've got a good agenda ahead of us today. Just as a reminder, these meetings are being recorded. They're made available on the website and also on our YouTube channel for you to revisit, whether that's a section or to share with others who may be interested in one of the topics. Our IT wizard, Chris Hoffman, he timestamps the videos in our YouTube channel so that you can go directly to the topic that you're looking for. As always, we appreciate your participation, the conversation, input, questions, comments. Please feel free to unmute yourself or to use the chat feature if you've got something you'd like to bring up to the group or a comment or suggestion in any of the topics that we review today. Having done all that housekeeping, let's move on to the actual agenda. We're going to start with Clay this morning, talking about timelines. Clay, you ready for that?
I am. Thank you. I apologize. It took me a minute there to get off of mute. Is it okay if I share my screen real quickly, Julianne?
Yep. There we go.
All right. Thank you. Yeah. So folks, just wanted to once again let folks know that there is ongoing conversations about just reviewing the timeline as it currently stands for the stop accepting data deadline for 3.4, and also moving out the milestones that you see here as the green flags in just helping states to understand when there will be broad marketability of the 3.5 products and when we hope the majority of vendors have moved and have products available. We have some positive indicators that we have a number of vendors that will be coming in Q4 of this year for compliance testing. So that's great news. I know Eric has been wanting to collect a little bit more information before any kind of review is done here. And Eric, I'll just ask if you might want to share just a few thoughts in regards to this. I know you've been thinking a lot about this topic. Are you okay sharing a couple thoughts?
Sure. Can you see and hear me?
Yes. Yep.
Thank you. Yes. So we talked with the Data Managers Council last meeting and basically decided we were going to gather a little bit more information, get and update our spreadsheet on several different basically timelines and what people thought. And then my plan is to take this to the state EMS directors, ask for their input. And that's my agreement with NEMSIS in terms of working with the state directors, not just relying on the data managers, but working through the state directors, and then take their input and basically make a decision. I think from what I understand in all the discussions, the 3.5 is not as much the issue as the keeping 3.4 alive for a longer period of time. So we'll, 3.5, as Clay calls it, is kind of a squishy date. We said, services would be available. We would be ready to start doing testing at this point in time. And then as services come on, that'll really depend on how quick the agencies want to move, and then if the vendors that support them are ready. So no definitive pushback yet, although I anticipate, that something's going to have to change. It's just where to set that date. And I've said this now on 2 calls, and I kind of like the expression. I don't want to plan for California, and I don't want to plan for Rhode Island. So somewhere in the middle is where we have to get to a happy ground. And I don't think that's going to be a huge issue. It's just a matter of being realistic. And the other part of that is that we really don't know what the next 4 months is going to look like. And I would like to think that we've hit the top peak of what will be the curve that starts to say, hey, look, we've got a handle on this. But with everybody going back to school and we're not putting closures in place, and we're not seeing huge numbers of people seeking vaccine again, even though we're getting close to highest levels of COVID, even compared to 2020. So more information, I guess, is going to follow as soon as we get with the state directors. And I don't know if that's going to be before the November NEMSIS meeting, whether there would be a call or whether that's something we'll just take up at the November meeting. And I'll be happy to answer any questions or listen to anybody's opinions or thoughts on it. But that's where I'm at right now.
Thank you, Eric. Any additional thoughts to share with Eric or the tech regarding this topic? I know folks have done a great job kind of expressing their insights both on the state and the vendor level. But if there are other comments, happy to talk about those now. Jen asks a great question. I think this has been on the forefront of several people's minds. Is there any talk about making the SEMSO all virtual with the COVID rise? Have you heard anything, Eric? I haven't.
I have not. In fact, Dr. Kramer and I and Dave Bryson are planning on attending in person. And as of Monday of this week, I asked Dr. Kramer if he was still planning on doing that, because we were submitting travel. And he said yes, although I have to be honest, right now, DOT probably would not let us travel. So everything is kind of fluid. That's November. So we're looking at a couple months out, which in terms of planning purposes sounds like a long time, but I know in reality in governments and in organizational planning, it's not really that long. So the answer is right now we're planning on going and being there in person. I have not heard Dia talk about making this a virtual meeting. Whether there will be virtual capabilities in some of the meetings, I would think, I can't speak for NEMSIS, but I would say that would be something that we would try to support. Certainly for like the data managers, the breakout meetings and such, I don't think it's realistic to get all the data managers there. I think there's going to be restrictions at government level, state government level. There's going to be funding restrictions, certainly at all levels. So, I think we're at a point for the next year or so, folks, where we're going to be doing conferences in person and they're going to have a virtual component. At least that's our plan. We're talking about that at DOT for NEMSAC and FICOMs and the meetings that we sponsor. Even when we have them in person, if we expect people to participate, we're going to have some kind of virtual thing. So let me check with Dia, and I'll be happy to get that information out to everybody just as soon as we know.
Thank you, Rick. Any other comments regarding this topic? Yeah, thanks, Jen. I appreciate the question. All right, fantastic. Julianne, I'll turn it back over to you.
All right, thank you. Next on the agenda, we've got our ET3 folks on the call with us, John Beckett and Brenda Staffan. If you would like to share your screen or provide an ET3 update, that would be terrific.
Thanks, Julianne. Yeah, I would like to share my screen if I could. Give me 1 second. Okay, you should be able to see it now.
Yep, looks good.
All right, great. All right, thanks. Just want to start out and just give some perspective on some of the activity that we're tracking with ET3. So from an account perspective, we're doing pretty well. We're pretty much a little over 10 million records now that we've received since January. So given the 8-month period that we've been in a go live mode, that's quite a bit of success in terms of being able to get folks to not only on board, but also be able to send us that amount of records. You can see here, the majority of the records, a little over 60% is the historical PCR counts. And the total counts from January to to today is right around 2.6. What's missing out of the 2.6 are some of the drop records. We certainly want to address that in the near future. So there's about 550K of those that are not reflected in that 2.6 value. So that puts us, pretty much at the mark that I just communicated. In terms of the folks remaining to be onboarded, we've got about 15 remaining, and we are going to be working with those that are in the process of trying to get onboarded. So we will give them assistance to bring them in. And in terms of the active submitters, it's right around 140 right now. So there's some folks that are, and I say folks, really it's the submitters that have already onboarded, but have yet to really start to send us the data. So again, that would be something that we would want to address from a strategy standpoint. And it is something that will be addressed in the near future. In terms of planned systems outage, we do have one scheduled for this Thursday. It is from 5 to 9 Eastern time. So just be prepared that you would not be able to submit during that period. Just to give some context, we are going to a new release on our data exchange server. That one is called CDX, and we are going to be implementing some new software there. So that is the time frame, and we don't anticipate that there'll be any issues with that port. So just want to give context there. In terms of the big item that we're working on right now, we are preparing for 3.5. Our timeline right now to open up and be in support of 3.5 is the September timeframe. So that will be a time where you can see some final documentation from us. In particular, we are updating the data submission guide. And there was a decision to be made whether we should update that guide or put out something that was a supplement to it that supports 3.5. And I think given some of the minor issues that were found in the guide that can be corrected, we just thought maybe a new version would be appropriate. And that will be something that we're targeting to be available next week. So updates are being made, and you can look for that out on the NEMSIS the NEMSIS ET3 website. So there is a piece out there on the NEMSIS website that is focused on ET3 documentation. And in addition to that, there'll be some other documentation, obviously the Schematron, as well as some of the documents that you've currently used for 3.4. So there's a scenario document that's very valuable. So that will be available there as well. Just real quick on some of the issues that we're tracking. There is certainly the need for historical data submission, but in some cases, meeting the 3.4 requirement is either impossible or very, very costly and difficult. And so we understand that some folks are still, maintaining the version 2 data for that historical period, and therefore will probably not be able to migrate that. So we understand that, and it isn't something that we're just not aware of, and we'll still put a requirement on you. We are aware of that, and likely would not expect that that data from you. In terms of the API key management, we are seeing where some of the participant vendors have to add some new IP addresses. And what that does is it requires that you go and get a new key, given the fact that that old key doesn't include those new addresses. So there is some significant activity there. And again, reach out to the help desk if you're having any issues around that. In terms of the dropped records, there's about 22 participant vendor submissions that we've tracked that we've had to drop those records because of incorrect agency field values. That's resulted in a 554K. And again, what we're going to do with that is reach out to the vendors if there are some incorrect agency values and have them updated. And in some cases, if our records on those values are incorrect, we've already implemented a path to update those as well. So that's how we're planning to handle that. So that's pretty much it for my update. And if you have any questions, feel free.
Hey, John, this is Samantha with ESO. Quick question. In the upgrade you're doing on the CDX this weekend, is that going to impact requesting new API keys in any way?
So I would, yes, it will be a case where the system will be completely down. And so the user interface as well as the API section will be unavailable. So yeah, you would not be able to make any requests, during that period of time. And that is tomorrow, by the way. It's not the weekend. Okay. It is tomorrow. Yeah, and it's only going to extend from 5 to 9. Yeah.
Okay, great.
Yeah. Yeah.
And one more question: is there still a limit of 5 API key requests per login?
Yeah. Yes.
Okay.
So
all right.
Yeah, that limitation's still there. Yeah.
Okay. Thanks.
Sorry.
No worries.
Yeah. Okay. I'm going to also, I'm not sure if Brenda, are you there?
Hey, John, this is Eric. I have a question for you, and
sure.
It might be for Brenda as well.
Yeah.
So these issue from participants vendors, like I'm looking at the slide that you see on the screen, the 22 participant vendor submissions dropped and the results 540,000 records dropped. Is there a list of these key things that are preventing records from going through that, and I guess this might be for Brenda, that is then being put out to all the participants to say, hey, look, in terms of aiding the billing process and making this more accurate and more timely, here are some of the main problems that we're seeing. Kind of like a quality assurance piece, I guess, on data entry, but this might help with some of the initial gathering if the services and agencies participating know, the top 5 things that are causing records to fail. Is it getting back to them? I guess is my big question.
Yeah, so we have those issues we've already addressed them from the standpoint of identifying what is being sent to us and who potentially, we've actually done some research to say, well, where is this coming from? So we can tie it back to the security key that was used to issue those records. And so we have all that data and information. And yes, it is something that we are not addressing it from a payment standpoint or, feedback standpoint just yet. But Eric, I will provide that message to the management leadership of ET3 and let them know that is something that would probably be good to do. Like I said, we have all the information around it, and we can just provide it should management and leadership want to do that.
I think that would be very helpful because we're talking about 175, 200 participants right now.
Yeah.
If this thing went out in grand scale, those small problems that we're seeing across 175 would just be, exponentially increase with the number of people. So knowing what they are going in to say, hey, in the history of doing this, we know that, agency ID is something that gets messed up and you need to pay particular attention to that. I think that would be very helpful.
Sure. Yeah, I agree.
Thanks, John.
Yeah. Okay, and I think Brenda may not have been able to make it. I know she had some other meeting conflicts. So I will end there. Let me just also say I've been out for about 3.5 weeks, something like that. And I know some folks have reached out to me. I apologize. I wasn't able to get right back to you. There were a few things that prevented me from communicating. And so we'll get some responses in the next couple of days. I'm just catching up on email. So just wanted to let folks know that I will be responding back to you. All right, Julianne, back to you.
Thank you, John. Are there any additional questions for John? All right, we appreciate you giving us an update on the ET3 project. Next on the agenda is Eric Chaney. Just want to talk a few minutes about capturing violence in EMS. Eric, you ready for that one?
Yes, ma'am. That's really just thanks, Julianne. That's just a request. So we have been working to try to get a handle on violent acts against EMS personnel in the line of duty, whether that be somebody being bit or spit or shot at, or something like that. I've talked about this in several meetings, and we're looking at how we could move that forward through DOT, what could be funded, who could be funded. There's a lot of federal rules about adding additional data. I don't necessarily see this as a part of the NEMSIS record. That's clearly not what I'm trying to accomplish. But if I tie it to a separate data collection process through the Fed, then it turns into a whole litany of separate things like Privacy and Paperwork Reduction Act and things that take months to years to complete. So I'm trying to work at another angle. My ask for this group at this point in time is if you know of anything other than the events data collection system that was set up by NAEMT, where that kind of data is being collected, whether it's at an agency level, just at a local level, whether it's at a county or municipality level. I would certainly like to know about it as we move forward. We're just trying to see what's out there, gather up some additional information on the project and scope it out so that we can see what it would take to resource it through our office. That's all I have. Happy to answer any questions about it.
Thank you, Eric. Any questions for Eric? Okay. Next item on the agenda is just really quick. I'll take that one. Just as an update, we are migrating NEMSIS into the AWS cloud. That is an ongoing process. As things, as work progresses with that, we will keep the stakeholders notified of any changes or impacts through either this meeting, well, probably this meeting and the Google group. So even for those who aren't able to make the V3 implementation calls, we'll put out those notices through the Google group as well on any impacts that migrating NEMSIS into the cloud will have on stakeholders. So just a quick update on that. That's an ongoing process. Next on our agenda, we've got Monet and Josh are going to talk to us for a few minutes about facility codes in the StateDataSet versus Schematron. Monet and Josh?
Hi, thank you, Julianne. Would you mind if I share my screen?
Sure thing.
Thank you. Do you see my screen okay?
Yep.
Okay. Good morning, everyone. Thank you so much for being here today. I want to briefly talk about the StateDataSet. And actually, I want to thank you all who attended the boot camp as well as the annual meeting, because during those meetings, we asked for your comments and your suggestions and your feedback and things that we could do to improve the quality of the data and the processes overall. So this is some of the feedback that I received from some state managers. The first example I'm going to show you has to do with a state level report that the state manager is seeing. And you can see here that they have clearly identified that the address in the facility name. So addresses are not in the correct location. This is a state level report, and that they're also getting a lot of not applicable and not recorded or blank information in their reports. The next example is similar. It's same facility, different spellings, spelling with just different variations not recorded, not applicables, and blanks in their reports. And so the states have really been, state managers have been really concerned because they've done the due diligence to provide the information in the state data sets. And they clearly, don't need 18 different spellings for one facility. So here's another example, just multiple variations on the information. What I did was I actually took a look at their state data set. Every suggested level is completed in the state data set. Custom elements, facility codes, agency information, protocols, procedures, medication. They have completed every aspect of the state data set. And so I checked to see how many listings they had identified for the particular facility name, and they only had one. The type of facility is in the right location. It's a hospital. Facility name is clearly identified with the proper code. The hospital destination is clearly identified, and the address information. Then here's another example of another location where there was only one listing for this particular facility with one spelling. And so while we have asked the state managers for over 2 years to help us populate the state data set, we're noticing that they're not being implemented in all products. So we're asking for your help again. This is a notice that I sent out on Mondays. It's a notice of the state resources updates. And you can see here that we've identified that there is a best practices document available. And we also identify myself and Ehlers as potential contacts if you have any questions or need additional help. And the states are listed with a link that will allow you to just simply import that information into your state system. The other reason I wanted to bring this up is because in version 3.5.0, this is a required piece of the compliance. And so in the white paper document for the receive and process systems, you'll see it's clearly one of the first items that you need to become familiar with. And then if you're a collect data product, then same, there's information about the state data set as number one in the overview requirements. Now I'm going to take a quick break and see if there are any questions that we can answer at this time or any concerns about the information that I just provided.
Just a quick thought that it's a plain text field, the name of the facility, and it's kind of hard to maintain those as the facility name changes. It's not supposed to do the job of the code, which is, I think, is what is the implication of this. So if you're trying to key off of the code, that's not what that field is really for. Or key off of the name, I should say.
Okay, Josh Legler is also presenting with me today, and I'm gonna have him help me address some of these questions about the way that the state data set is created and the intention for use. Thank you, David, for the question. We appreciate that. I'll actually turn it over to Josh at this time.
All right, thanks, Monet. So Monet has kind of covered things from the state data manager perspective of, hey, we've published a state data set. It has really good information about all the facilities in our state. And we make that state data set available in a standard XML format for vendors of local products to use as a reference for their customers to set up the facilities that they transport to or pick up patients from. And then as she illustrated, the state sees that those local level products actually send in lots of different codes and lots of different spellings for and names for the same exact location, or perhaps a blank code for that location. So that's kind of the message targeted to developers of local level systems. And as she noted, that's part of the compliance process in 3.5 is to illustrate that you were able to use the information from the state data set to set up your software for the test cases that are tested in that compliance process. Let me switch perspectives here a little bit and talk to the states and the developers of that help states with their state level state data set and Schematron development. So a lot of states have Schematron rules that say if you take someone to a facility, then the facility code has to be a code that's recognized by the state. And so this creates what I would say is kind of a dependency or a relationship between the state data set and the Schematron schema. The state data set being the place where the state says, these are the facilities that we recognize. And the Schematron being the place where the state says, we have a rule about the facilities that we recognize. And it is that you have to take people to one of those facilities, use a code that's on the list. A lot of states implement that Schematron rule by having a Schematron assertion test that just has a long comma-separated string of facility codes. And some states have thousands of codes. That becomes a little bit inefficient in Schematron and also becomes a bit of a maintenance burden. Whenever you add a new facility to your state data set, you have to also go into that comma-separated list and make sure the code for that facility is in there in your Schematron schema. There is an alternate approach, and that is to simply embed your state data set within your Schematron schema, and then your Schematron rule can just do a key lookup against the data in the state data set. And you can validate facility codes, but you can also use it to validate medication procedure codes and things like that. So this idea of embedding the state data set right within the Schematron schema should reduce the maintenance burden on states. It allows them to ensure that they never get those things out of sync with each other. Whenever they update the state data set, they simply copy paste it into their Schematron schema and put that out as an update. So just as a reminder, I did a training on this particular concept last March of 2020. Monet, if you want to show that next slide. There we go. So that particular public training session is available from the NEMSIS website in the state trainings page. Scroll down to that March 3rd, 2020 training on writing efficient business rules. And the concept of embedding the state data set in the Schematron starts about 10 minutes in on that presentation. So if you missed that, or you're working for a vendor that wants to help a state to use this approach, go ahead and go back to that training session and take a look at that. All right, Monet, back to you.
Okay, are there any additional questions?
We got some.
Monet, this is Dave Rogers from the state of Minnesota.
Yes,
question.
Dave.
So how would embedding the codes into or the state data set affect vendors that have to report to multiple states? For example, we've got agencies that work out of North Dakota, but they pick up in Minnesota, transport back to a North Dakota site, but we have our own set of codes that are reported back. So is there, and same with Wisconsin and Iowa as well. I'm just wondering how that would work for those vendors that might report to multiple states or have agencies that work in multiple states.
Dave, I'll respond to that. My first recommendation to you as a state data manager would be to adopt the facility codes used by your neighboring states for those facilities. So you could list some Oklahoma facilities in your state data set, but use the codes that Oklahoma assigned to them. That would make it a lot easier on the local vendors and agencies. But for local vendors and agencies, there is definitely the reality that an agency that reports to 2 states might have to send a different facility code to each of those 2 states. And so that means a mapping activity for that local agency and their vendor, so that they transport to a particular facility, but when they send that record to one state, the code gets mapped one way, and when they send it to another state, it gets exported and mapped out another way. Hence why my encouragement that you would coordinate with your neighboring states so that less of that mapping has to be done.
Is there, sorry, this is Dave again, but is there any, I know there's probably been some discussion with the data managers, but is there any thought of standardizing what values those are? For example, in Minnesota, we use the CMS provider number for the hospitals. We have some generic ones for nursing homes and things like that, but for the hospital facilities we transport, we use the CMS codes.
Yeah, that's a good idea. And some states, or I think a lot of states, use the license number that's assigned by their state hospital licensing office. And then there's also been talk about, hey, we could use an NPI. A hospital could have multiple NPIs, of course, but that maybe they select the main NPI for that hospital and use that as its facility code. I think all of that could be worth some additional discussion among state data managers. Caitlin from Angel Track had a comment that I hadn't quite finished reading through. It has to do with having a mechanism within the state data set where a state could continue to have a record for a facility, but have it marked as inactive. Yeah, we did have the concept of inactive stuff in way back in NEMSIS version 2. It was part of the agency demographic data. You could have some inactive records in there. That kind of concept was removed in NEMSIS 3. So the state data set as currently designed is only to hold active records, and same thing with agency demographics, holds only active records, like personnel who are actively with the agency today. And so the way you see changes is by following the changes as those state data sets are committed to the Git repository, and you see that a record was removed or something. But I think, Caitlin, what you're getting at also is the validation effects of that. If a facility is removed on January 1st, 2022, but an agency still needs to submit data, some backlog of data for calls they went on last year when the facility was in fact open and existed, and how to deal with that. So it takes some extra effort on the part of states to not be too aggressive about removing those facilities. You want to make sure you've gotten the data for records that did go there before you remove a facility.
And the naming as well. So that they get bought out, they change their name. Oops, you lost all those charts.
Yeah, so the name change was effective on a certain date. So technically speaking, the old name was correct at the time that the incident occurred.
Yeah, Josh, this is Clay. Maybe just a couple questions. First, I just wanted to make sure, Caitlin, I really appreciate your description. It's very clear. Is there some aspect, though, of that we haven't just mentioned here? Is there another issue related to this that we're not thinking about, or did we capture it? I know you may not be able to speak, but yeah, feel free to leave a message. I guess my other question is related to what David said, and wow, I think that agencies change their name much more often than they end up changing their code. And maybe I'm wrong about that, but I think why a state would change a code is probably less dynamic, is why a company may change hands or need to represent a different city name or something. I guess, David, how important is it to tie a name to a Schematron rule or another facet of the NEMSIS system that then requires correct spelling and correct capitalization and spacing? I guess I'm wondering why we're just not relying on codes.
That is actually a question. It's come up a few times that some states have gone to that level of they don't trust the code. So they've had experience where the code comes in, but it wasn't the right code. And so as a double check, they implemented this name check as well. And it makes things more difficult, really. So now you have to maintain the names as well as the codes. There are several examples. I'm not trying to pick on them per se, but it's a burden.
Yeah, thank you, David. Other comments related to that? Perhaps from states. I see that Mark commented, and Anne.
Yeah, this is Amber in Colorado. We do not have one of those rules that checks the name with the code, but we've definitely talked about it. And I think to the exact point that was just brought up, it's a lot of times we do get incorrect codes for the facilities. And sometimes it's just a matter of there's a code for the emergency department versus the inpatient pavilion. And sometimes they'll get those confused and use the incorrect code for the same name. Or if you have large hospital organizations, you get folks that just click the very first university that they see, or UC Health or something, rather than actually looking through the full name. And it all just depends on how the provider sees it in their system. So yeah, definitely it's one of the messier fields that we have. And a lot of times folks get those codes incorrect, or they don't have the code available in their third-party vendor system, or it's connected to the wrong facility. And it takes a lot of digging for us to figure that out. And, we can't really backlog those types of changes. So it's messy.
Yeah, great description, Amber.
This is Anne in Arizona. Oh, sorry.
No, go ahead. Go ahead, Anne.
I'm sure, I think this could be a huge side conversation sometime too, or maybe not even side, just like a topic, because we've struggled with this too. We've never required the name. I know I've talked with other states and I completely understand their reasoning. I've ended up running a report every once in a while where I just look, because I allow them to send in their own name, and that's how I catch if they've been sending in to the wrong one. It doesn't seem to happen too often, but we also have those generic codes, so I have to check those to make sure people aren't kind of, I hate to say abusing them, but kind of using them for everything. So it takes a little time on that side. I think I don't worry about so much us getting it wrong with having different names, because I think if they labeled it differently within the product on the front end, we still wouldn't know. They'd still be sending us, maybe they're picking one thing and sending the name that matches the state. That's one reason we haven't done it. But and I'm going to get into a technical part that maybe the vendors will have to talk about a little more. I know in some way the codes aren't completely connected to the name. So like when you do, this is going to sound silly, but when you try to do simple reports, and we do a lot of ours in SAS, but when you try to do simple reports for a whole state and you have 75 different names for a facility that you're allowing, which is what we do have sometimes, it's a mess. So you have to have somebody who's able to do that, because you can't say, pick the code, but show me the name that I have in my D facility. Like show me the E disposition, what is it, 01 or 02, the code, but then show me the name that I have displayed in the D facility. And if you can link those up, then it would be a lot easier. I think that part was always kind of a pain that we had to work through. And I think this is an interesting conversation, though, because I think this has become a huge problem between trying to match things and restrict them, which we definitely need to, where we get all kinds of crazy stuff in. But at the same time, it's a huge process, like Josh and everyone was talking about, like to go through and update everything. And there's several steps, and it's not very efficient, I feel like.
Yeah, Dave, did you have comments?
Yeah, I did as well. So in our system, we do have a Schematron rule, and it does cause an error if the incorrect code or the code that doesn't exist. That gives me the ability anyway to say, go back to the agency if they're not checking it and say, you're sending the incorrect codes. And this is where I found the issues between states. Our system does have the ability to link that code to what we have our facilities labeled in our system. So I can get consistent facility names and run reports that way. It'll also give me the ability to pull what value they sent so I can see, and typically it's all across the board, different spellings, incorrect spellings, different abbreviations, but I find the codes to be very helpful because then that links it back to what I know the facility is.
Okay, great. A lot of good comments by Adam, Keelan, and Cassie about potential ways to utilize the names for verification, but not to tie them to warnings or worse, errors in a Schematron file. So that's incredibly helpful.
Hey, Clay, this is Brian in Virginia. We're also one of the states that had to implement the exact code and name matching. And it wasn't something that we wanted to do, but we spent about a year trying to work with all the various agencies to help them understand why we needed consistent reporting, because it wasn't so much that we would get a code with various spellings of names. We would actually get a proper spelling of a name with the completely wrong code. Like I said, we spent about a year, and we put the first half of 2018 as our benchmark, and we ended up with about 64,000 errors out of about 300 and some thousand records. So we just felt like we didn't have any choice. But I'm wide open to, doing something that works across the board for everybody, because, I think I might have emailed you a couple of weeks ago. We want to help be part of the solution, not part of the problem. So if there is anything that people have suggestions on so that we can, make this work across the board, I'm wide open for it.
Yeah, thanks, Brian. That's a great example. Yeah, reading through Keelan's message there, Josh. Yeah.
One other thing, and I was looking at Keelan's, I'm sorry, this is Ann. I remember just talking to an agency the other day that was asking if in our state we had to match the names, and we don't. But they mentioned something because it's the way their dispatch is set up, which we don't have a statewide dispatch, so it's an area that I'm not very sure of, but I don't know if that's ever the issue, is that it's not so much the agencies or even the EPCR vendors have control. Maybe it might go back to dispatch. Does that ring a bell with anybody?
So sometime if they have a CAD integration that might be sending a facility name that the vendor implementation just takes directly. So it might be a hospital name, something like that. Does that sound like what they're talking about?
I think so. Sometimes I realize there's a component in play that I don't even realize is an issue. And so I think that's one reason this issue has been so complicated.
Yeah, and we did notice an issue with that with a couple of the agencies in Northern Virginia. I don't remember the exact specifics because it was about a little over a year ago now, but we ran some reports and all of a sudden we noticed a tremendous drop off in calls for a particular hospital. And come to find out, there was something that was going on with the CAD import, and it was labeling things with the wrong county. So there's definitely always a potential that CAD could be importing something that nobody even realizes that's an issue.
Clay, this is Cassie. How are you today?
Hi, Kathy.
I know here in Georgia, we don't necessarily require the facility's name because agencies change all the time. For example, 3 of our major hospitals here in Georgia is Northeast Georgia, Emory, and Northside. Well, they keep buying all these small local community hospitals, and their name changes to, let's just say, Piedmont Newton, because they bought that facility. But however, the code for that facility generally stays the same. And if we require the name, then that causes records to not go to that facility. So when we keep the code the same, but the name changes, that facility is still able to get records on that patient that was transported to their facility.
Yeah, good comment, Cassie. Yeah, there's a, this has been really enlightening. There's a validation that's happening both directions here. So this is interesting to hear. And then of course the whole issue with CAD is another type issue that we really haven't tried to address. Yeah, reading.
You could also have cross-state issues as well. So California, Oregon, they name their facilities slightly differently, then that becomes a burden as well.
Yeah. Josh, any other comments? You've been listening patiently. Oh yeah, go ahead, Cassie. Sorry. I'm sorry, Cassie.
I can say one of the major issues that I do see that has come up the other day is, say I have a 911 truck that is on the borderline of Alabama or Tennessee, and they transport to that emergency department on the Tennessee or Alabama side, then the hospitals aren't receiving reports because of that code mismatch, because we code the facility different in our system than the surrounding states. So I think that is very feasible, and it makes sense for especially bordering states where you're on the border and sometimes the closest facility might not be in your state, to work with each other to use the facility codes that you know that the hospital would be able to get that patient care report, especially for those time-sensitive emergencies like a STEMI or a traumatic injury, because those hospitals need those reports sooner than later.
Josh, I think
unmute myself here. Yeah, there's been great discussion here, both verbally and in the chat. So that'll be good to review through everything that was put into the chat as well. And I think this is an area that would be ripe for further discussion. One, among state data managers, there may be more coordination that could happen, and maybe some kind of consistent decisions that state data managers could come up with as a group. That might be helpful. And then I think some back and forth with state data managers and vendors to come to some agreements about what's necessary, what's helpful, what's valuable, all of that. Another thing to keep in mind as to why this topic is so important, a lot of states make data available to hospitals, and they need to ensure that they're making the right PCR available to the right hospital. And that comes down to this question of where the EMS agency transported the patient. So that's probably one of the reasons that you see a lot of attention on these two data elements, the facility code and name, from the state perspective, is that duty that the states have to ensure that they're making the right PCR available to the right facility. So it's an important area, and sounds like there's some good further discussion that could be had.
Has it ever come up, the idea of NEMSIS maintaining a matrix of all the state's facilities, just as they choose to define them. So if you're like, yeah, I have this facility, and instead of in the state data set, if there was a registry, like an RX norm code type of list that was published by NEMSIS, would that be a potential help to some of these issues?
Yeah, good question. In the NEMSIS 3.4 state data set builder, that product made it easy for states to import facilities from other state data sets. So the idea being that, in Oregon, we list half a dozen Idaho facilities in Oregon's state data set. And we just imported them from Idaho's, or Washington or California. But I think you're talking about more of a centralized repository of facilities that would be more of a nationally coordinated rather than state level.
Right. It would be a help to air services who have all sorts of places they go.
Yeah, we've talked about this before, David. It's a great point, and maybe we need to revisit it. I remember we went, and this has been years ago. It may even have been at the beginning of V3, but we went to CMS to determine if they utilize a single code associated with facilities who receive Medicare, Medicaid patients. Clearly the MPI wouldn't work, but I don't remember what their decision was, but it seemed like they were still struggling with the same issue. We'll reach out again. I think this has been a great discussion. I think Josh had some great comments. I think we need to kind of put together some ideas that we can bring before the state data managers, and then also on the vendor side, and see if we can gain some more congruence here to kind of help with this process. This has been helpful.
CMS does publish a data set of the hospitals that they have registered. I think it's called hospital info, hospital data, something like that. So you can download that, but it's not complete. It's not all the hospitals in the US. So.
Yeah. Thanks, David. That's helpful.
One other thing I wanted to mention is we're trying to put together a training in October. So if you have additional thoughts that you have not added to the chat, please send them to us, and we will review that information as we're trying to plan for the October state level or vendor level training. Thank you.
I just have one other small point. It came up the subject of reporting based on the names. I'd recommend against trying to use the name of the hospital in your reports, because even if you do it perfectly, the name will still change over time. So a report that uses the hospital name as the identifier for that hospital is that's probably not the best way to write that report.
Well, thanks everyone for all the great discussion on this topic today.
I did mention in chat that we do capture all of that and review it later. So we really appreciate when you put your comments in chat. We know some of you can't unmute to be able to comment, so we appreciate that. Next on the agenda for today, Kevin White's going to give a brief demonstration of a new public dashboard that we have available.
Thank you, Julianne. Yes, let me go ahead and share my web browser here so that we can all join in on the fun. So today I'm going to talk about, as Julianne mentioned, a new dashboard that we've launched in the public area, although it's actually an update of one of our dashboards that we originally created in version 2. and that's the 911 call complaint dashboard. We updated this from version 2 because it was one of our most trafficked dashboards even after version 3 was launched. And so we decided to update it using version 3 data. It's a simple dashboard, simpler at least than many of our other dashboards. The purpose of this dashboard is to highlight the link, or perhaps lack of link, between the call complaint, the provider's initial impression, and the primary symptom as recorded within the PCR. So for example, if we go left to right, we want to look at falls. So call complaint is fall. And what does that come in as in terms of provider's impression and then primary symptom? And of course, we can go the other way as well. Maybe we look at, for example, alcohol use within our provider impression. And there are 2 here in this list. So if we select them both, we can get a good idea of how that actually maps in terms of what was the call complaint and what was the primary symptom. So simple dashboard in terms of when compared to everything else that we have provided for people, but as I said, still very valuable and highly trafficked. And so we hope that you'll be able to either make use of this directly, or perhaps use it as a tool to educate people on EMS. Are there any questions or anything to add? Anyone has to add about this dashboard? Excellent. And as always, if there are more detailed information, you can always click through to the companion document as well to look at the details behind the dashboard. Thank you, and back to you, Julianne.
Thanks, Kevin. Question in chat, if that's available by a state level. And right now, this public dashboard is only available as a national aggregate. We don't break that down into states at this point. Hey, Kevin, would you put the link to where that dashboard is located?
Absolutely.
All right, thank you.
Yeah, Julianne, and I'll just mention, really makes a good point. So we can kind of look at that as to whether or not we could add just a drop down on there that will allow states to look specifically at what's going on there. I can see where that could be valuable. Would other states, I'm sorry, Julianne, would other states see that as valuable to be able to kind of compare what your calls are coming in at and then, or coming in as, and then looking at impressions and symptoms? Would others find that valuable?
And I just got a message in chat from Anne. It's an interesting because of the project regarding lights and sirens use versus needed for it versus risk of collision. I think that's an excellent point as well.
Okay, thank you. Yeah, thank you, Julianne.
Mm-hmm. Yep, and it looks like Pennsylvania would be interested in that as well at a state level. All right, next on our agenda, Eric, if you have any other items from Office of EMS, this is a great time for you. Checking. All right, Eric may have been pulled away on a phone call.
No, he's here. I'm sorry. He's just having technical difficulties.
Okay. All right.
The topic is the NHTSA update, correct?
Yes. Any items from the Office of EMS?
And other than the things that we've discussed today, I really don't, other than, I say this on every call now, please be safe. please take care of yourself, take care of your family. Everybody's been working crazy hours for the last year and a half, and I realize that. That's why we're trying to not put any more burden on anyone. And as we move into this next couple of months of uncertainty, which will kind of set the tail for really the next 6 months to a year of what we're going to be focused on, not just at NHTSA, but in EMS in general. Take your leave, take your time, make family first, and really focus on that, because at least for the near future, things are not going to get a whole heck of a lot better. So you're all going to be working like crazy. So when you get a chance to take some time, take advantage of it. That's all I have, Julianne. Thank you.
All right. Thank you, Eric. Are there any questions, comments, topics that anyone on this call would like to bring up?
Kayleen would like to talk about demographic files, my favorite topic.
It is your favorite topic, Monet. What vendors help their agencies submit DEM files? Are there vendors on the line that would like to talk about how they support their agencies in submitting DEM files?
It's Frank Digitech. We just submit them and the software submits them automatically when details are changed by a client.
So it's part of your internal process for your product?
Yeah.
Okay. Thanks, Frank.
Sure.
And Caitlin brings up a great point. Compliance requires it to be automatic at least once a year. And we still see DEM files end up being a good chunk of work for Monet. I'm sure all of the data managers can attest to getting phone calls and emails from Monet in helping to resolve DEM file issues. Are there any other vendors that would like to weigh in on that? Monet, is there any other clarity that you'd like to give on the DEM file issue?
No, I would just like to ask and invite Kayleen to come off mute if you're willing to express your concerns. I believe the major issue is that for some states, it's almost rounding up to 2 years that I have sent the same list of agencies that are experiencing inconsistency between D agency 01, 02, and 04. Sometimes those values match and sometimes they do not match the PCRs. So we did a training on this a little while back, but the problem that we're experiencing is although we are sending the information to the state managers are requesting assistance from the vendors. And however, we're not really getting an adequate and timely response. Some states have required their local agency managers to populate the information. So it's different in every state, but what we're trying to do is we're trying to resolve failed submissions. There are so many hundreds of thousands of records that fail to enter the NEMSIS repository simply because there are inconsistencies with those values. So what we're asking is when we send the information and we beg and plead for help, we just want for you to look at the information and help us resolve it. There are times when I've been on calls with the local agency folks to help populate the information. And literally within about 5-10 seconds, they fix the values and can resubmit the DIM files. So for the amount of time that we're seeing now for over several months and weeks and years to resolve issues with the same agency, it's becoming painful for state managers. Sometimes they simply won't take my call or respond to my email. And I know that we all have great working relationships, and we just want to continue our excellent rapport with each other. But we do need help with these DIM file issues to resolve the failed submission issues and the quality of data that we're getting at the national level. I believe I've talked about the issues adequately enough, but if I miss anything and someone wants to come off mute, please do so.
Adam has a good question in chat. How do we know what states are submitting? Oh, I just lost it. How do we know which states are submitting DIM files to NEMSIS through their state system versus requesting that vendors submit it to the state?
I think I'm going to ask Laurel to help me with that question.
Yeah, Monet, this is Clay. I can respond to that a little bit. I don't think we track that. I mean, it's a great question, but I don't think we've looked at that. I think we at the TAC here could all name some states that we know are one way or the other, but that might be a good exercise for us to walk through.
And then Kaylin also has a concern when she sees vendors using other numbers than what the state has. And when they ask, they get told that NEMSIS accepts it so it doesn't get changed. So is there a process to overcome that issue between what's being accepted and what's actually accurate?
Yeah, what we decided is we realized that state agencies, EMS agencies are transporting patients between state lines or across state lines. But what we said is the state that licenses the agency and provides that agency with the number, we would like for that D-Agency 04 number to represent the state that licensed the agency. And when there are cases that an agency might need two different numbers, they might need to be represented in two states, then we should have DIM files for the agency in those two neighboring states, because the PCRs have to match the demographic files. So we get the failures when there's just an inconsistency between the PCRs and the DIM files. But I believe that anyone who's still experiencing problems with this, we would love to do like a webinar, a quick 5-minute webinar just to review the information, and we can really help you clear it up quite quickly. So please reach out to us. We'll be happy to help resolve these issues with you.
Hey, Monet, this is Brian in Virginia. I know that we've been one of the ones that have been struggling to get our demographic files over to NEMSIS. So for any of the vendors that have customers in Virginia, if your customers are struggling with a piece of information or something that's causing it not to work, you can have them reach out to me. You can reach out to me. As agencies have been running into questions they don't know how to answer, I've been getting those answers for them. And I can't think of a good analogy, but it's kind of like trying to pull teeth out of a tiger. I mean, we're doing it one at a time. But if there's a breakdown someplace in an agency needing information, my emails work 24/7. So just let me know what the error is, and I'll get the data that they need to put into their system so that we can get those files processed and sent over.
Thank you, Brian. I appreciate that.
And there's another question from Adam in the chat. Is it true that NEMSIS only accepts PCRs at their level if they get a demographics file? If so, is it on the vendor to ensure we push the dem files? Not every state wanted the dem file as we were providing it, so we have it off by default. So is there a process that you're recommending for that, Monet?
Adam, please send the dem files to us. It's been written up in a white paper that responsibility, if you're the state system sending us the PCRs, we've asked for that dem file information from you. So my friend, call me and we will.
Okay. I could refine that question. Yeah. And then we're not the state vendor. To my point, it was to my last one. If we could have an Excel or poll that says, like, here's the name of the state. We want the PCR vendors, the field vendors, to provide the demographics, or they're optional. We'll take them if you have them, or do not ever send us demographics. Our state vendor sends it, that kind of thing. So we know what state wants demographic files from the EMS agencies.
Yeah, and I think Adam's question goes back to that idea of us taking a look and see who's sending what to us. And so we'll work on that. I think this is a good topic as well for us to dig in on a little.
So is that my first question up there, though? Is it true that the PCRs only show up in your dashboard if you have demographics available for that agency?
Yes. Yeah, okay. That's correct, Adam. Yeah.
Right.
Yeah.
So we got to figure out what state wants demographics coming from the field providers versus that their state system sends to NEMSIS.
Yeah.
Yeah. Okay.
Yeah, and then this is Josh. I'll do just a self-promoting plug for the presentation I did during the annual meeting about demographic data, which really kind of attacks this whole conversation that we're having right now.
Josh, will you add that link to the chat?
Yeah, if I can remember, was that day 3? I'll look it up. Okay.
And then Mark asks a question, why wouldn't a state want a dem file? Are there any situations where the states don't want that?
Yeah, covered that in my presentation too. It's okay. There are some technical issues in a product that's used by a lot of states that results in duplicate objects being created when updates are submitted. So you start out with 5 personnel and then you submit an update. And now you've got 7 or 8 personnel, but 3 of them are duplicates, things like that. We expect a lot of that issue to go away with NEMSIS 3.5 because of adding the UUIDs. But there's still work for state level software developers to do to be able to manage and avoid that sort of duplication that happens when information changes.
Thanks, Josh. We'll get that link to day 3 video thrown up in the chat. They are long videos, but they are timestamped as well. So you should be able to find the subject from day 3 of annual meeting. Oh, thank you, Josh. He just threw it up there. All right, excellent discussion. Thank you so much for your participation. Really good topics that we're gonna need to continue to dig into and help resolve issues as they come up. Upcoming events, we have our September training on September 7th, how to assess and improve data quality. And that invitation went out through Google Group. We'll send that again too, so that everybody has that, and that's open to everyone. Our next meeting for V3 implementation is September 8th, same time, same place. Thank you all for your participation, your input, chat, and discussion. We really appreciate that. And it's such a good audience to have those discussions across multiple disciplines and with states and vendors. So thank you so much for being with us today. And oh, there's another, okay, there's a direct link from Chris in the chat for that presentation from Josh. So we'll leave chat up for a little bit longer. We won't close the meeting fully out so you can get to those. And I think we're good. I think we're done. Thank you everyone for being with us this morning. Have a good day.
Yeah, thanks for all the great comments, folks. Thank you.